All right, you're watching Good Morning Nigeria on the network service of the NTA. And just before we begin the conversation on the World Kidney Day, let's take this background report from Oyeyemi Ajayi.
The kidneys are two bean-shaped organs located below the rib cage, one on each side of the spine. Healthy kidneys filter about a half cup of blood every minute, removing waste and extra water to make urine, which now flows from the kidneys to the bladder through two thin tubes of muscle called ureters, one on each side of the bladder, which stores urine. It also moves acid that is produced by the cells in the body and maintain a healthy balance of water, salts, and minerals such as sodium, calcium, phosphorus, and potassium. Aside these, it also makes hormones that help control the blood pressure, make red blood cells, and keeps the bones strong and healthy. When the kidneys are damaged, waste products and fluid can build up in the body, causing swelling in the ankles, weakness, poor sleep, and shortness of breath. Without treatment, the damage can get worse, with the kidneys eventually stop working, and such can be life-threatening. Talking about types of kidney disease, there is the acute kidney disease, which makes the kidney to suddenly stop working. It is caused by non-availability of enough blood flow to the kidneys, direct damage to the kidneys, and urine backed up in the kidneys. The chronic kidney disease is a condition where kidneys can't filter toxins or extra fluid from the blood as well as they should, though the condition can vary, but the disease usually gets worse over time. But treatment can slow the progression of the disease. If left untreated, chronic kidney disease may lead to kidney failure, and at this stage, it is called end-stage renal disease, which must be treated by dialysis or kidney transplant. Diabetes and high blood pressure are the leading causes of chronic kidney disease. Some forms of kidney disease are treatable, and the goals of these treatments are to ease symptoms, help keep the disease from getting worse, and lessen complications. In some cases, treatments may help restore some of the kidney function, but there is no cure for chronic kidney disease. Now, how much efforts are being put in place by researchers to ensure that chronic kidney disease becomes treatable? What are the major symptoms that can prompt one to immediately go to the hospital for treatment? These are some questions guests seated in the studio will be answering soon.
Thank you, Oyeyemi Ajayi, for that background report. We have here in our studio Dr. Salahu Ibrahim Kwaifa, Chief Consultant and Physician Nephrologist, and is the head of Nephrology Unit and Dialysis Wuse District Hospital in Abuja. Dr. Kwaifa, you are welcome to Good Morning Nigeria.
Good morning and thank you.
All right. Also joining us in the studio is Paul Shobande, person living with kidney disease. Paul, you are welcome.
It's a pleasure. Thank you.
All right.
Okay, and we have also been joined from our Kanu studio, I beg your pardon, Professor Aliyu Abdu, consultant physician and nephrologist at Aminu Kano Teaching Hospital in Kano, professor of medicine, Bayero University, Kano. He is also the immediate past Secretary General, Nigerian Association of Nephrology. Prof, a pleasure to have you join us.
Good morning, Nigeria, and happy to be with you.
Well, let's begin the conversation.
Okay. Let's kickstart our conversation with Dr. Kwaifa here in the studio. You know that the kidney is one of the vital organs of the body that play, a vital health role in the bodies. How delicate is the kidney?
As you are aware, the kidneys are two organs, that paired organs that sit at our backs and they carry various functions that have been highlighted just now. And the kidney is such a promising organ that not a small injury now will reflect, a kidney disease in the lab. In fact, you have to lose more than 75% of your kidney function before now the test that we do for kidney function becomes abnormal. So kidney is actually a resilient organ, very, very resilient. And now that's why, because there are two, you can actually donate one once you satisfy all the criteria for donation. One just like a spare, you can give your brother or your friend or your parent one kidney, and you can live a normal life with one kidney, because one kidney is enough to sustain life. And that's why it's so resilient. Yeah, kidney is a resilient organ.
So why do we have two?
That's why you have two because you can give one to your brother or your sister that in need. That's why we do kidney transplant. You give your kidney to your brother, you live with one is spare. There are some people that are born with one kidney, one did not develop, and they live their normal life. They do their normal life. In fact, if they don't undergo some certain test evaluation, they wouldn't even know that they have only one kidney. So other people roam about the street with only one kidney. So one kidney is enough to sustain life. And anytime you hear somebody with kidney disease being sick, that means the two kidneys are affected equally. Most diseases that cause kidney disease affect the two kidneys equally. So any disease that affects one kidney is not serious, it's serious but not that serious. Because even if you lose one kidney, you will continue to your normal life with one kidney.
So it's possible that both kidneys can be affected the same way? Equally.
Most of the diseases that cause kidney failure affect the two kidneys equally at the same time. Like hypertension, like diabetes, like glomerulonephritis, like drugs we ingest. All these painkillers, if you're going to take them on a long time, that they can cause kidney disease. Like some infections also that affect the kidney. They affect the kidney equally, like HIV, hepatitis B, hepatitis C, and herbal medications also. All these affect the kidney equally. It's not just one kidney. If it's one kidney, you won't be sick. Because the other one will just take care of the function.
Okay, Dr. Kwaifa, thank you very much. I don't know if our Lagos guest via Zoom is ready. Okay, so we have also been joined from Lagos by Dr. Odeyemi Ayola, consultant physician and nephrologist from the Lagos State University Teaching Hospital in Ikeja. He's public relations officer of the Nigeria Association of Nephrology. We welcome you to the program.
Good morning, everyone.
You are there now. What are those symptoms to look out for, that could determine that you are having a healthy kidney or healthy kidneys, or that your kidneys are having some form of trouble without necessarily waiting, for it to enter those critical stages when you begin to manage?
Okay, thank you very much. Just like what Dr. Quaker said, and from what has been the video that was projected before the commencement of this program, the kidneys, they are primarily responsible for excretion of waste products and maintaining a state of water balance in the body. They also produce a particular substance that is required.
Oh, okay. I think we lost Dr. Ayola there temporarily. Perhaps we'll get to Professor Abdu, who is in Kano. Prof, let me throw the same question to you. How do we know, sitting here, for instance, how do I get to know that my kidneys are all right or they are not without, seeing signs that indicate that I'm having some form of trouble that I now begin to patch up?
Thank you very much for the question. The symptoms the patient with kidney disease present depend on the type of kidney disease. If it is an acute kidney injury, the symptoms becomes obvious within hours, at most days, and there will be reduction in the production of urine, there will be body swelling, and because of the accumulation of the toxins that are supposed to be removed by the functioning kidneys, those toxins affect other parts of the body, like the heart, like the brain, and like the bone. And then the patient can present with the symptoms affecting those affected organs. On the other hand, if the type of kidney disease is what we call chronic kidney disease, The patient kidneys are affected over time and is slowly progressing. Therefore, symptoms manifest only at the terminal end of the disease when greater percentage of the kidney functions are lost. Like Dr. Koipa said, one can live with only one kidney. So if it's only one kidney that's affected or greater percentage of the other kidney is normal, the normal kidney try to compensate. So symptoms developed gradually. But the most important gradual symptom that one should begin to observe are changes in urine. Like the patient become to pass urine that is very frothy. Frothy, I mean like foamy, like when you put omo in water and then and begin to shake the water. Those forms, that's how the urine usually begin to manifest. And this foamy urine is because of excretion of proteins in excess amount, more than the normal amount that is usually excreted by kidneys. So this is an early symptom of kidney disease. Another early symptom is facial swelling. When you wake up in the morning, the face is swollen, but as the days goes by, the swelling disappears. So this is an early symptom of kidney disease, which may progress to generalized body swelling affecting the abdomen and the legs. But usually, the swelling of kidney disease starts from the face, and it's usually in the early morning. But when the disease is advanced, other organs of the body are affected. The patient can have affectation of the brain and present with what we call uremic encephalopathy, where he can have seizures, he can have abnormal sensation and may even lead to coma. The heart can also be affected. He can have what we call pericarditis and also advance to affect the heart function and present with heart failure, difficulty in breathing, body swelling, cough at night, and easy fatigability and so on. The patient can also present with symptoms of lack of blood because, as is mentioned in the report, one of the functions of the kidney is production of hormone that helps in the formation of red blood cells. If the kidneys failed, this formation of red cells is reduced and the patient can have what we call anemia, which means reduced blood level in the blood. And the patient can present with symptoms of anemia such as easy fatigability, weakness, and so on. So these are become pale, look pale, and so on. These are signs because of the other organs affectation of the body. But the main problem is they won't be able to produce urine. They will accumulate fluid or water in excess in the body, and this excess water affect the function of the lungs and the heart, and then the patient have difficulty breathing and they present to the hospital. So these are some of the symptoms. Symptoms depend on the type of kidney disease and then at the time at presentation. And there are other types of kidney disease which are not causing kidney failure. Kidneys can be affected by simple infection of the urinary tract, and that one they present with pain in the loins, difficulty in painful urination, and increased frequency of micturition, increase in the number of times one goes to pass urine. And when he goes to pass, he pass very little amount. So other affectations of the kidneys may not present with symptoms at the early stage. So they can only be detected when you are investigating for other types of diseases, and then is incidentally found that your kidneys are affected. As you rightly said, one can sit down, continuing his normal life, but his kidneys are not functioning very well. And because of the nature of kidneys and how God created them for us, one can stay with kidney disease for a very long time before it start manifesting symptoms of kidney failure. So it's good to go for checkup. It's good to know the status of your kidney functions frequently. I hope I'm able to answer the question.
Professor Abdul, for that. You have been able to answer the question. It's always good to go for checkup, early checkup. You have advised that it is important for us to be able to detect the kidney failure. Now, let's go back to Lagos, where we still have Dr. Ayola. Dr. Ayola, you're with us now? Okay, fine. Just like Professor Abdul said, that you only get to know that your kidney has issue when it is at a critical, point. Will you say that the failure of the kidney is as a result of our lifestyle? No, I think we're still...
Am I audible? Am I audible? Okay, so this lifestyle you're talking about has to do with what we take in. Plays a very important role. The fact that we consume a lot of food that is rich in salt and rich in salt, then also the fact that unrestricted access to drugs, use of over-the-counter medications also plays a very major role. Then obesity too also plays a very major role in kidney disease. It's also very important for us to know that use of herbal medication also increases the risk, not just increases the risk of having a kidney disease, but also increases the rate of progression for those people that already have an established kidney disease. The common causes of kidney disease in our environment is hypertension, it's diabetes, is infections, just like what Professor Abdul said, and infections like HIV is a very common cause of kidney disease in our environment. So our lifestyle that has to do with unprotected sexual intercourse with multiple sexual partners also increases the risk of having a kidney disease. Then if you are hypertensive or you are diabetic, it's very important for you to be on medications and not just use this medication, but also go for regular follow-up care to be sure that your blood pressure is controlled and also that your blood sugar is also controlled. It's also very important for another very important lifestyle is the lifestyle modification, is the use of non-steroidal anti-inflammatory agents for myriad causes of pains. We should know that non-steroidal anti-inflammatory agents like ibuprofen, diclofenac, aspirin, all these medications also damage the kidney over a long time use. Lifestyle factors that can severely hamper our kidney function. And so I'm not sure if I've been able to answer that question.
Well, yes, Dr. Ayola, you've been able to answer the question, but I would have stayed with you. It seems we are having some technical issue with your connection there from Lagos. Let's come back to the studio where we still have Dr. Kwaifa. At what point do we have a total kidney failure?
Yeah, kidney disease that, apart from acute one, as Professor Audi said, is the one that occur abruptly within hours, days, at times weeks. So you have all the symptoms. And the patient may undergo renal replacement therapy in the form of dialysis. That's acute. Usually acute resolves. Either wholly or partially it resolves. So you may not need to continue dialysis ever. However, if you have chronic kidney disease is divided into stages. For us, the clinicians, we have stage 1, stage 2, stage 3, stage 4, stage 5. Most patients with stage 1, stage 2, stage 3, and even early stage 4, they don't have symptoms whatsoever. You are fine. You can do everything. You are fine. In fact, people begin to develop symptoms when they're in stage 5, at times late stage 5. Wow. That's the final.
Wow.
So most cases, stage 4, Only few symptoms, maybe tiredness, easy fatigue, and weakness. That's all. But most people develop symptoms when they reach stage, but at final stage. So it's such that it gives you the liberty. It allows, goes on. And that's why we emphasize the importance of screening. And this screening is very simple screening. I have a small pneumonia, we call it BUCS, B-U-C-S, know your blood pressure. Because blood pressure is the main important risk factor in this environment. Very, very important. Then urinalysis, stand for urinalysis. Urinalysis, you can pick blood there, you can pick protein. Protein invariably is a sign that your kidney is not doing well, because protein are not supposed to appear in the urine that we can easily check and they be there on the ordinary check. We excrete protein quite right in low quantity that cannot be detected. But by the time that we can detect with ordinary dipsticks, we use that paper you dip in the urine and you check the color. So by the time you can do that, then the kidney is not working well. That's your urinalysis. Then you check your blood level, blood creatinine. Creatinine is a substance that's supposed to be excreted by the kidney. The kidney takes it out of the body. But when it accumulates, now we use it to know what stage of kidney disease you have. Then of course, sugar level. Sugar, because diabetes is #1 in the world, cause of kidney disease. However, in Africa, it's #3. So, but all over the world, #1 cause of chronic kidney disease is diabetes mellitus. That is sugar disease.
Sugar disease.
Yes, but in Africa and Nigeria and wherever, hypertension and a form of kidney disease called glomerulonephritis. Usually for some infections in childhood, down now will progress at the background, and subsequently after 15, 10 years, 20 years, then somebody will come with kidney disease very early in life. We call it chronic glomerulonephritis. So these are so you will never know until when you check. So that's how we advocate. People should at least do at least once. This test I mentioned, I don't know more than maybe.
How often?
Once a year. Once a year. But if you can do every 6 months.
And is it affordable? For
Yes,
instance,
it's
for
just, like
workers who use who depend on the NHIA.
Yes, it's so available. So blood pressure is free. You don't have to pay for blood pressure to be checked. Urine sugar to check. Sorry, blood sugar to check. It's no more than 1,000 naira, 500. Some places 500, 1,000 naira. Urinalysis is around 500 to 1,000 naira. Creatinine is also around 1,000. Mostly, even at private, it's about 2,000. So 5,000 is enough. A little bit above 5,000, you can do the test. So once
in government hospitals or private hospitals?
Even private, these tests that I'm just mentioned, they are not up to 10,000 naira. Okay. Even private. And government is just around 2 to 3,000 naira.
All right. Let's engage Paul Shobande now. You sat patiently. We've taken some time to lay the foundation for this conversation. And I'll begin by asking you, what does it mean to live with kidney disease?
It's actually very difficult to live with kidney disease, especially in Nigeria. Finance is always the problem. It means that one will not be able to eat what you want to eat. You can't drink water as much as you can. Imagine this heat wave we are experiencing and you're very thirsty. If I should drink water the way I am thirsty or my body requires, that means maybe in the next 2 days or thereabouts, I'll be rushed to the hospital.
Why?
Because I won't be able to breathe. Like,
if you drink?
Yes, if I drink too much water.
Too much water.
Too much fluid, not water. Fluid.
Fluid, okay.
Whether it is tea, whether it is pap, whether it is anything fluid.
Okay.
Can easily accumulate within the body and then make it difficult to breathe. Like for instance, yesterday evening, I have to be rushed to hospital for dialysis because I wasn't able to breathe well all through the night. So that's that difficult. Then also tiredness. One cannot do as much as he can when he's healthy. You can walk a short distance and then you'll be tired. Maybe you do little work, you are tired. So that tiredness is always also very there.
How did we get here? How did you find that you have kidney disease?
I would have said maybe fortunately for me, I would have been able to detect it earlier enough, like 2 years before I was knocked down. Yes, because I remember when I went to hospital, they said, why is it that your blood pressure is not being controlled? So they sent me for that test that Dr. Kwefa mentioned. So they found out that the creatinine then was a little bit elevated, maybe about 300 or plus. But they said I should go. No, creatinine level.
Okay.
So I was asked to go and do like a follow-up test. So the follow-up test now satisfied me. Okay, I have no problem. I'm okay. So 2 years later, I was. In fact, everything went bad. At first, when I wake up in the morning, like he said, I start observing swelling in my leg, just by the side of the leg, but it doesn't stay that long. I will just like maybe it's a normal thing, maybe in my sleeping position, and so on. Then later, I start experiencing fatigue after work. I'm a teacher, so after teaching, if I sit down, you find that my leg is very heavy, and so I can't lift it. Then at the final stage, I can't eat again. Start vomiting. Anything I eat, I will vomit. Then this pain all over the body. In fact, I was rushed to the hospital, and then I was confirmed end stage CKD.
Okay. So, but what's your stage right now? Are you much better now? Can you do? What are the things that you couldn't do before now? Now that you started treatment, what are the things that you can do comfortably?
Yeah, with regular dialysis, I can go to work, still do a little of teaching, but not, like I teach in government government schools. So, we take a lot of classes before, but now maybe just after one class, I'll be tired. I can't take as much classes I can take before. But if there is no fun to do dialysis, because it's not as if maybe once you do dialysis today, then tomorrow or next tomorrow you'll be okay. No, the dialysis can only carry me for like 2 days or 3 at most.
You need to do another.
Then in the 4th day, I will have to go for another dialysis. So if I didn't go, then I will go back to that other state when I will not be able to do anything. I will just be lying down. And if fluid has been accumulated in my chest, I'll find it difficult to breathe. I'll just be coughing.
Okay, thank you very much, Shobande. We'll get back to you. But let's go to Kano right now, where Professor Abdul is still there. Professor, one of the things that Shobande just said is that he first went for some checkups, and he was wrongly diagnosed. They did not detect on time that he had issues with his kidneys. What can be done to correct all these wrong diagnoses, because we have been having cases of people, not that as a result of their nonchalant attitude, but they do go actually for checkups, but they are diagnosed wrongly. What can be done to correct this?
Yeah. Thank you very much. A lot can be done. First of all, if I were the physician that saw him first and I assessed and found out that he has risk factors of kidney disease and I got a creatinine of 300, if he comes again and found a normal creatinine, I wouldn't take it lightly, because it's either of the two, or he had an acute kidney injury, which, as Dr. Kwepa rightly said, is reversible, or something is missing. So I wouldn't take it lightly. I will follow it off. And the importance of detecting chronic kidney disease early, we would have prevented this patient from being in this condition now, because, as Dr. Kwepa mentioned, is stage 1 to 5. If left untreated, it's naturally progressive. If you see a patient today in stage 2, if you didn't do anything, the next time he comes to you in stage 4 or stage 5. Luckily enough, there are things that if you see the correct physician, he will be able to institute those management lines and then prevent the progression from stage 3 to stage 4 or stage 5 to stage 4 to stage 5. You cannot prevent it from happening completely, but you can slow the progression. At least it can take years or up to the end of the life of the patient before he goes to the end stage and things are happening. One of the ways that we can do that is the physicians and the patient should be vigilant and suspicious, and then act on any suspicious results. Number 2, the laboratories need to be standardized. If you see the way private laboratories are open in major cities, you'll be surprised. Everybody now is a diagnostic center. People go and open and do whatever they want. Even some tests that are done in advanced centers, they can easily be available by the roadside, and then they write all kinds of results. I see these frequently in my practice. Somebody will come and with a scanning result that said this is a type of disease. While I know ordinarily those type of diagnoses cannot be made based on ultrasound scanning. So you see from there, you know the result is suspicious. I think the government need to come in. In some states, there are private health services regulatory agencies. They need to wake up and protect the public from unsuspecting public from this type of practices that are open without qualified personnel. If the laboratory scientist is qualified, when he sees a diagnosis, I send him a lab form, and I wrote the clinical signs and symptoms of the patient, and this is what I'm suspecting. And then if he has a record of what was the result before, and then a correct scientist will now doubt the result. That's why in a good lab, there are hierarchies. There are people that do the test. There are people that look at the test and then certify that the result is fine, and then before the results are released. These are found mostly in government hospital, but I don't know. A few private laboratories does that, but most laboratories don't do that. No check. So the regulatory agencies need to wake up and do the right thing to protect the unsuspecting public from access. Just like private hospitals are open, doctors are supposed to know their own limit based on your practice and experience. And when you get a case that is beyond your level, you should please refer early, because some of the problems are the patient are retained unnecessarily for a very long time before they are being referred to the nephrologist. So the opportunity to initiate treatment that will slow the progression are lost. So the patient comes to you in end stage and you can do little. And as he rightly said, the management of end-stage kidney disease is very, very expensive, even in developed countries. Therefore, for a country like us, the emphasis should be on prevention, early detection, and then when you detect early, you institute measures. If it's beyond your reach, please refer early the patient to the correct physician that can assist the patient very well. Don't hold the patient unnecessarily when you know that you don't have the skills to manage him appropriately. And these are my take on this.
Very much, Professor Abdul. Prevention and early detection, it's very vital. Okay.
Yeah, I wanted to get back to Paul. Or if the Zoom guest is there, perhaps we can reach him first. Okay. Let's get to Dr. Deyemi, who is in Lagos. Dr. Deyemi, please tell us, how do you think, because the little we've gathered so far is that it's very expensive to manage a kidney disease. I will get to Paul on that, really, to get first-hand experience. But tell us, what do you think can be done to ensure that it doesn't become too much of a burden to patients who fall into this category? And then, what's the role of government in this?
Very much. Before I answer that question, a billion people worldwide are worldwide. And if you come back home to Nigeria, 15 to 30% of our population are actually living with chronic kidney disease. So just like what Professor Abdul said, early detection is key. Even after making a diagnosis of chronic kidney disease, it's very important for us to be able to early referral to nephrologists to retard the progression of this kidney disease. So what can actually be done? It's very expensive, very, very expensive. And the goal is to make sure that our patient doesn't get to a point where they require interventions like dialysis and kidney transplantation. The average cost of a session of kidney dialysis in the country is around 50 to 60,000 naira per session. And on the average, our patient requires at least 3 sessions. So, so 15, it's around 12 to 15, 20 million naira. How many Nigerians have access to this? And that's where the government plays a very critical role in the management of kidney care. I am a strong advocate for having a renal care initiative where treatment of kidney disease patients can be highly subsidized, even
Okay, I think we've lost again Dr. Ayola from Lagos. Let me get to Paul Shubande. Give us an idea, apart from the dialysis, or if you want, a combination of all of it, how really affordable has it been for you to manage your own kidney disease, given the dieting aspect of it, the dialysis, which you say you have to do, say, every 2 days, right? 2 days or 3 days?
Yeah.
And then the diet requirements. How easy has it been to manage?
Well,
do you have access to insurance, for instance?
Well, the insurance we have in Nigeria has not been of much help. Usually, they give only 6 sessions in a year. And that session also depends whether it will be honored by the hospital or not, because the hospital complains that the healthcare insurance don't give them the money. That if they do it for you for free, then for them to remit the money to you is always a problem. So sometimes that's also a challenge, even though there is that only just 6 period. But like this year, for instance, I've not really assessed more than 2. And even the 2, I have to pay part payment for one of it so that I can be allowed to dialyze. Talking about affordability of the disease, the truth is, with my little salary, I was not able to care for myself, thanks to friends, family, and colleagues who usually donate money. Sometimes if I go to work, they saw the way I look, they go around, collect money from other fellow colleagues and say, yeah, go to hospital, go and dialyze. Family members, oftentimes I call them, they give me money for dialysis. Some friends too. If the family member cannot provide, I call some friends. But sometimes there may be no money.
And then you
So what do you resort to when you don't have money?
If there is no money, sometimes I have to beg the nurses. I'll do it on credit. Then when I have money, I'll pay back.
Yeah. And by then you may require to do another.
Yes. Usually, as the prof said, I'm supposed to be doing it 3 times a week.
Okay.
But because of funds, I just struggle, let me say, every 5 days.
Okay.
Like I said, I will only be okay for 2 days after the dialysis. The other days, with more struggling. I will not be able to eat very well. I'll just pinch food. And
when last did you do the dialysis?
Yesterday night.
Yesterday.
But don't you think, have you considered a transplant, you know, knowing that in the long run, a transplant may come cheaper?
Yes, I'm on it. The problem, like mentioned, is fund. And that's a problem. And I'm discussing with my family members whether I can get donor for me. But I think if I get a donor and then the fund, I'll be able to do the transplants.
Okay, Shubande, we'll get back to you. Let's come back to Dr. Kwaifa now. As a nephrologist, just like Prof said, you know, from Kano, that early detection, it's very, very vital. So how can we improve awareness about kidney and kidney disease among the general public to ensure that it is, you know, detected early? Because it's very, very vital.
Yeah, this part of the activities of World Kidney Day actually. Every year, March, second week of March, we go out to educate people. Health education is the key. We have to talk, and then also advocacy. People need to know what the kidney does, how it functions, and why it's so important for us to check the function of the kidney, whether the kidney are doing well or not. And there are a lot of things that we take for granted actually. So like exercise, regular exercise will help the kidney health. Exercise, avoidance of too much smoking, avoidance of ethanol, and that's alcohol. Then when you have high blood pressure, which is a major risk factor for us here, they ensure that it is well contained, well treated. Because if you don't treat adequately your blood pressure, it go ahead and that a lot of burden on the kidney, which will lead to chronic kidney disease. So if you are diabetic, ensure that you have a good sugar control, diabetic control. And then you avoid things that can damage the kidney directly or indirectly, such as frequent use of painkillers. Painkillers that we take for granted, if you use them for a long time, it may lead to kidney disease. So also herbal medications. Herbal medications, when you use them, they may cause acute injury, but subsequently acute injury, we all know that 50% of it can go chronic again. And when you have chronic kidney disease, just like egg and chicken, when you have chronic kidney disease, you are at risk of acute injury on top of chronic. If you use certain things like herbal medication or over-the-counter painkillers and all those things. So there's a lot of things that we need to do. Common screening for hepatitis B, screening for hepatitis C. Hepatitis B can be prevented by vaccination if you are negative. You can take vaccine and prevent yourself. Hepatitis C is a curable disease. You can cure it. So, and this disease and HIV as well, all these infections can also affect the kidney. People that are into drugs, illicit drugs also, they are at risk of contracting, kidney disease or infections that can actually damage the kidney. So the most important, everything now goes down to awareness. We need to create awareness. And that's what we are doing. It's part of the activity of Kidney Week. We go out to the public, we go out to the community, we do free screening. We screen for blood pressure, we screen for blood sugar level at diabetes, we take your weight and do a lot of things, and then we do counseling. So, but the issue, our culture of going for screening when you are normal is very, very low. And that's what we are doing. We have to create awareness. We have to bridge the gap between we know these things and the population. The greater part of the population are not aware that. And one thing again, most chronic kidney disease that will lead to what he's suffering from is silent until late. But if it's detected early, we can forestall measures to either retard the progression or to block it somehow. Or to, if you, for example, now you have a disease that will progress to end stage within 10 years. Now, with good appropriate measures, you can live 25 years, 30 years without the end stage, because the disease can be progressed. Because we have a lot of drugs now that offer promise, a very great promise in terms to retard kidney function. We have a lot of medication that can actually work to delay the progression or to retard progression of kidney disease. So awareness, that's the key. And there's no way people can be aware except through campaigns like this. We tell people that kidney disease is real. All over the world, we have about more than 850 million people suffering from kidney disease. That's at 10%. Nigeria and Africa, we have prevalence. about between 13 to 16%. Even if you take 10%, Nigeria with approximated population of 235 million. So about 25 or 23 million people are suffering from kidney disease. That's the crude estimate. It will be more, much more. So what we are saying actually is this, just the tip of an iceberg. People that are sick, people that have symptoms, those are the ones that comes to us. Greater part of the population that have kidney disease, they're not even aware. And that's why this World Kidney Day now is very vital and apt. So sensitize people that you can be normal, just please go and check these functions and inculcate regular healthy lifestyles. Sort of avoidance of sedentary lifestyle, exercise regularly, avoid too much salt, take fruit and vegetables, and avoid all these unprescribed pain relievers. If you are sick, go to the doctor and say, doctor, he will give you a limited prescription. But some people, you find that taking all the analgesic almost every day. Some cannot even function without taking them. So this is the habit that ultimately will lead to destruction of the kidneys.
Because some people have given reasons why they are on these painkillers on a daily basis, that them not taking it, it aggravates whatever problem that they're going through. And when we talk about painkillers, we have different types of painkillers, but all these paracetamol, Panadol, and all that stuff. Which one in particular? Because they will tell you, oh no, let's take this one. This one will not affect the kidney. And is it all the painkillers?
No,
or just few of them?
Not all.
Yeah, okay.
Like you mentioned, paracetamol. Paracetamol is safe. There are other painkillers that are safe to the kidney. So we prescribe them. When you come with your chronic pain, we know how to make combinations to ease your suffering by avoiding potentially dangerous painkillers that affect the kidney. Like Dr. Demi said, Ayola for logo, he said ibuprofen. It's very common. In fact, it's one of the most prescribed painkiller in the world. Ibuprofen, they call it ibuprofen, they call it Advil in the US. It's one of the most common because it's very strong and potent. Now in Nigeria, we have diclofenac. Diclofenac comes in different brand, different name, Cataflam, Voltaren, all that diclofenac. Flotac, there's so many of them, but it's diclofenac inside. So diclofenac is the one that we use more frequently. Also, ibuprofen we use it a lot here. But these are the drugs that, and we call them NSAIDs. There's so many of the indomethacin. Indomethacin, that only say aspirin he mentioned, and high dose, not in low dose. Low dose, the one you take to prevent clot, that one is a different one. But in high dose, or adequate dose to relieve pain. So if you use them for a long time, they affect your kidney function. So if you go to the hospital, the doctor will assess you. The need, usually it's not going to be prolonged. It will be a week or 10 days and something like that, and then you review. And then if there's a need, he may change for another group that are safer to the kidney, whatever.
Okay.
Just one moment. Actually, I want Dr. Ayola, I think he's back now, to actually contribute to this particular conversation concerning, creating the awareness among public for early detection, because I know that you are the public relations officer, Nigerian Association of Nephrologists. In what way are you going about, creating awareness, among the public? Are you working with the media organizations, or what ways are you doing enough?
Thank you very much. When it comes to the awareness, so we have various layers of awareness. It's not just awareness of the public. We also need to create awareness for the healthcare providers, and yes, is very key, because most times they are the one that they see this patient early enough than we nephrologists. So we want to also let them be aware of the common symptoms of kidney disease and the need for early referral to a nephrologist. But more importantly, when it comes to the public, Nigeria is an highly religious and cultural environment, and that is the reason why we need to take the awareness and the education down to our churches, to our local communities. We need to get the buy-in of the local authorities, the hobas, the imams, the pastors. Everybody has to be on board to be able to understand the fact that we need to prevent kidney disease and not wait for it to happen. So, and that's the reason why World Kidney Day that takes place every second week in March, and that's the reason why it's very important, because we actually go to schools, we go to communities, we go to vulnerable areas to educate and to do general screening for the public. I was in a screening exercise where somewhere in Lagos, and it's so surprising that about over close to 70% of the people screened are actually hypertensive, and about 60-70% of them are not even aware that they're hypertensive. There was even a young lady that just came in and sat down, and we checked her blood pressure, and the blood pressure was over 200. So we can't overemphasize the need for us to continue to create this awareness, to continue to be able to educate our public. Much has been said on the common things that has to do with our lifestyle that causes kidney disease, and more importantly is the use of herbal concoction, the use of non-steroidal anti-inflammatory drugs that have been once said. Then this growing problem of illicit drug use among our youths, it's very worrisome, and that's why this year we are concentrating on actually the adolescents. We are going to schools, we are going to university, to tertiary institutions to screen our adolescents, to screen our youth, and know how many of them have this kidney disease already or have the risk factors. Then to also educate them on these various things. So it's the awareness and education is not just a day event. It has to be ongoing. As an association, couple of years we've intensified the need to continue to create this awareness and to educate the public, and to also get the buy-in of the government, which is very key in management of this worrisome illness. Thank you.
Thank you very much, Dr. Odeyemi Ayola. Thank you very much for your comments. We'll pause here for a break, and when we return, I'll have a question for Professor Abdu in Kano. You're welcome back. We are still on to Good Morning Nigeria on the network service of the NTA, and we've been discussing kidney health and access to care. Now, talking about access to care, and that's why I want to head to Kano, where Professor Abdu, Aliyu Abdu, who is consultant physician and nephrologist at the Aminu Kano Teaching Hospital, is. Prof, several countries appear to provide free dialysis to take care of, in recognition of the cost of treatment to patients. Well, in Nigeria, the NHIA, at least from the experience of Paul Shubande, covers just a little 6 sessions in a year, which doesn't scratch the surface. It wouldn't really keep you alive if you have to rely on that completely. What can we do to drop the price, or the cost rather, of kidney treatment in Nigeria?
Thank you very much. And as you rightly said, you have had first-hand experience. Most of us are members of families at one time or the other have suffered from this illness, and we know what we went through. And even we physicians, if I tell you the stories of the experiences I had in managing patients with kidney failure, it may lead to people to shed tears. So pitiful and sad to some extent. I think we have a lot to do in Nigeria. First, the government should do something. There is nothing wrong in offering this treatment free to Nigerians. If countries like Niger Republic, Sudan, Egypt, South Africa can offer free treatment of end-stage renal disease patient, why can't Nigeria do? And even if it is not free totally, we can have subsidized treatment for this patient, because this type of illnesses like CKD is a lifelong treatment. It's not like a hernia, you come and have a surgery and that's the end of the story and you go. Or like treatment of infection, you have pneumonia, you get antibiotic, you get treated, and that's the end of the story till you get another pneumonia again. But the whole life depends on these kidney replacement therapies, either in the form of dialysis or in the form of transplant. So when it is about life, and one thing with CKD in Nigeria is that it affects younger people. If you compare the type of chronic kidney disease we see here and the one they see in the advanced country, you see that here it affects people at their most productive age. Like this patient we are discussing with, he's a teacher. If we give him treatment, the pupils, the parents, and Nigerians can continue to benefit from his services. He's a teacher. And look at the commitment and dedication in him. Even with illness, he didn't lie at his house. He still tries to do his service. Most of the patients that we see are at their economically viable age group. So I think the government need to come, and we can do things as individuals, and we can do things as community, apart from the government support. I have first-hand experience of what a community can do. There is one place in Jigawa State, it's called Hadija. This place, they have high prevalence of kidney disease. In the whole of Nigeria, they are one of the places, and another place in Enugu, Propolasi reported. And this place, they have high prevalence of chronic kidney disease. And the community come together, and they built a dialysis center which is run by the community, and they are offering subsidized dialysis. Dialysis is 5,000 naira a session in that center. I was there as late as last week. We went and donated some dialysis consumables to them just to support them. And then state governments can do something. Borno State, Yobe State are areas with high prevalence of kidney disease. Then the government of Borno State built a very large dialysis center and is offering dialysis free of charge to the indigenous of the state. The same thing with Yobe State. They have high prevalence of CKD. Many patients are dying. They built a fantastic kidney center and they're offering free dialysis. They did it in Bauchi in earlier years of this Malan Yuguda, but it's no longer there, I think. I don't know whether they're still doing. Katsina are doing free dialysis. They were doing during the time of Umar Eradu as a governor. So state governments can do, federal government can do, community can come together and help themselves, and individuals can do. In my center, one person spent over 2 billion naira to build a state-of-the-art kidney center in my place. And when you complete, he said he's going to offer subsidized dialysis. And these are individuals. And again, we can come together as Nigerians and advocate in National Assembly and advocate with politicians and talk to people that are in government, that are close to us, that can listen, and tell them that these are what people go through when they have kidney disease. It happened in America. The pre-dialysis they are getting in US, it didn't start by chance. It started with advocacy. People come together, went to National Assembly, protested, and there was a law enacted to give free treatment for patients. Since those years, it has continued, and patients are getting free services in US for patients with kidney disease. So it can happen. So in summary, the federal government can do something, the state governments can do, the community can come together and help themselves, and individuals, philanthropies, form foundation. We have a foundation here in Kano that we advocate for assistance, and one person gave us 100 million naira. And what we do, we sponsor transplant. Even last month, we pay 4 million for a transplant to a patient. And we do buy consumables. Every quarter of the year, we select a dialysis center and go and donate consumables. I was in Hadija last week. We donated about 3, 4, 5 million naira worth of dialysis consumables to support them. So we can do a lot as Nigerians. This disease is real, it's with us, and it affects our brothers, our sisters, and it's unlike other types of diseases. This is a lifelong treatment. So they need support. Even the transplant we are advocating is not without its own consequences. Because after treatment, after the transplant, you need to be on drugs for life. And those drugs are expensive. And you need to get support. Otherwise, you lose the kidney after the transplant. So it's a lifelong treatment, and people need to be supported. It's beyond the reach of many Nigerians. And the government, as a policy, should identify centers that, even if it cannot be provided everywhere, but maybe in each geopolitical zone, maybe in each area, we can get centers of excellence for the treatment of kidney disease. Or we can get a national institute, a national center that will take care of training manpower, treatment of patients with the disease, and then offer subsidized service. And I think this is the way to go. This disease is beyond individual, and even if you are rich, there's how far you can go with your riches, because this is a lifelong treatment we are talking about. So I think people need to have access to quality care and equitable access, not ordinary selective access. As the theme of the World Kidney Day for this year is access to equitable access to care, and also and good quality medications. This is our theme for this year, and we call for Nigerians, well-meaning Nigerians, to come and be with us in looking for help and assistance to the patients suffering with chronic kidney disease. Thank you very much.
Very much, Professor Abdul there. That is, the treatment and management of kidney is a collective responsibility of everyone. That is the government and also the general public. Thank you very much. We'll get back to you later. Let's come back to the studio. I have a question for Dr. Kwaifa, but before then, let me ask Shobande. I mean, you have listened to the contribution of Professor in Kano about the responsibility of government and the people. You, as a particular, what do you think? What do you expect from government? What are your expectations?
Well, like you said, in some countries, like from my own research, thank God you also mentioned it, I find that some African country even offering it free. That's both dialysis and transplants. And government can actually do a lot in that regard as well, subsidizing. And I think maybe there is no any institute that have been set up to even advocate, give care about kidney. The way there was this awareness about AIDS, that they even set up an institute to take care of it. I think we should have an institute like that, say National Kidney Foundation of Nigeria or so, that will even educate people. For instance, I was able to learn a lot from National Kidney Foundation of USA about my condition, and that gave me some respite. And even to donors, those who were willing to donate, they will ask a lot of questions. Can they still give birth after donating? Would they have to be on some drugs for life, and so on and so forth? All of these questions can actually be taken care of by these institutes if they are set up, so that people will not, because sometimes people can die out of fear. But if proper information are dished out to people, it can prevent, and if one have it, it can help the person to manage it.
Okay, thank you very much, Shobande. And let me now come to Dr. Kwaifa there. I mean, we have been looking at the issue of treatment and management of kidney so far. Has there been any, what do I say now? What advancement have been made in kidney treatment and transplantation in Nigeria? Has there been any advancement at all?
Yes. Kidney transplant in Nigeria had been going on since 2000. It first started at a private facility, but Kano at Ekiti, where Professor Abdul is, I used to join them at times during their transplant session when I was in ABU.
Okay.
There. So they have done a lot, and they're doing a lot at a highly subsidized rate. And there are a lot of private facilities, even in Abuja, that are offering transplant, renal transplant to patients. There are fewer public institutions that offer transplant in Nigeria, but Kano is the lead. We have Ife, we have Ibadan, UCH Ibadan, and Lawrence started also, but I don't know whether it's sustained. The issue is boils down to financing and sustainability. Most of these public institutions, they are not well financed, and the sustainability is the issue. Kano, he just had him that they wanted to advocacy, and people actually came to their aid. There are a lot of help from people, philanthropists, to support Kano program, and it succeeded. The first transplant in Kano was supported by one philanthropist, a Kano indigenous. He paid for people. He brought the doctors to do the transplant, and subsequently, our own doctors also were trained. So and now Kano, they do their everything in-house. Someone donated laboratory equipment that will make them do a lot of testing before transplant. So they are complete. So we have gone far actually. So much, if it comes to kidney transplant, Nigeria in West Africa is the lead. We're the first one to start in West Africa, and we have experience more than any other country in West Africa. So because annually we do a lot of transplant, but most of it goes to private, because as I told you, funding the public institutions is the issue, and therefore most centers that have started transplant at a cheaper rate could not sustain it simply because they lack funding. But by and large, if you have the funds, transplant is always available in Nigeria, and we have gone a long way. We have a transplant association of Nigeria also that look into all these aspects. We just had a meeting about a few months back. Transplant association of Nigeria. In Nigeria, we have research patients from the US, from so many come to UK. They all came to support South Africa. They came to support us. So we're doing a lot in transplant, and we have gone far actually. The issue is a cost. Transplant in public institution, or in private, is very expensive, from 16 to 80 million naira. How many people can afford that? But in public institution, in county, you can get it at 5 million. 5 million.
Wow.
5, yes. So most of my patients, some of them, I send them to Kano also, through Professor Liu.
Okay.
No, all right. I don't know if Dr. Ayola is still with us. Okay. Dr. Ayola, we are talking about how to drive down the cost of kidney care, and I'm wondering, you are a public relations officer. What amount of advocacy do you put into your work? Because apart from government policies, laws that make this thing institutionalized, do you reach out? There are a lot of well-to-do Nigerians. Instead of funding leisure, for instance, can they fund necessities like kidney care? How much advocacy do you do to reach out to those who can afford it?
Okay, thank you very much. Advocacy in respect, I still want to say that the government still plays a very central role, because the cost of bringing down to the country. If there is ease of bringing in these medications and consumables for hemodialysis or for kidney transplant patients, then I believe it's going to go a long way to reduce this burden. And just like what Dr. said, it is not just, I always tell my patients that it's not affording the
from Dr. Ayola via Zoom there. But let me head to Professor Abdu. It's the same question I'm going to put. Thankfully, all of you belong to the same associations, and it wouldn't be out of place if I ask if you do a lot of advocacy by reaching out to those well-to-do Nigerians across the country who can afford to fund these things, maybe build hospitals just for kidney care, build centers, make donations regularly, own foundations that can take care of kidney for people. How much of these advocacies do you do?
The Nigerian Association of Nephrology have done a lot with each subsequent leadership. Each president and his team put in his best or her best so far. We are able to reach up to the level of the Vice President of the Federal Republic of Nigeria during the time of General President Muhammad Buhari, during the time of Professor Tunde Salako as our president. We got audience with the Vice President. We discussed the issue led by Dr. Ibn Bamboye and others. We had a very fruitful discussion with the Vice President of Nigeria. That's the highest we can go. And in terms of the advocacy, in the last National Assembly, there was a bill for the establishment of Kidney Center, Kidney Institute. The Nigerian Association of Nephrology made presentation during the public hearing, and also I personally also presented a paper during the public hearing, and many other professional bodies did. However, up to the time of that National Assembly, that bill couldn't materialize. It is our hope and prayer that this current assembly will look at that bill and do the necessary thing. In that bill, it was advocated for the establishment of a National Kidney Institute, and also the issue of subsidizing dialysis and so on. I want to call on members of Senate and House of Rep currently serving to look at that bill and see what they can do. It has passed the first and second reading and went to public hearing. And let's see how we can make it better to help Nigerians. As I mentioned earlier, it started like this in America, and now Americans are enjoying free treatment as a result of that type of advocacy and a National Assembly support. So we're also working with individuals, groups. As Kwaipa rightly said, there was issue in kidney transplant in Nigeria. There was a public outcry on malpractices, and the Transplant Association, together with Nigerian Association of Nephrology, came together and made complaint. And as I'm talking now, the Federal Minister of Health have set up a committee to produce a guideline on kidney transplantation in Nigeria, and the committee is working, and very soon the results will be submitted to the Ministry for further action. I was privileged to be a member of that committee. So in terms of doing our best, the association have been doing its best. With each subsequent leadership, we try to do as we can. We have reached the highest, second to the highest leadership level of the country, and presented the problem. We were at the National Assembly. There was a bill that went into first, second reading, public hearing, and I think we have done. Even though I can say that maybe our best is not good enough, there is still room for many people to come together with us to advocate. As I said, this kidney disease has affected, even not directly you or myself, but somebody very close to us must have been affected by this disease, and we know how much these people suffer, as we had first-hand information from Mr. Paul. It's a very debilitating illness, and it is beyond common ordinary Nigerian to shoulder.
All right, thank you very much, Professor Aliyu Abdul, for your contribution there, giving us, the efforts of your association in the advocacy for the treatment and management of kidney in Nigeria. Thank you so much for coming on Good Morning Nigeria. That is Professor Aliyu Abdul. Do you have can I have the details there?
Yes, Professor Aliyu Abdul, consultant physician and nephrologist at Aminu Kano Teaching Hospital, Kano. He's also Professor of Medicine, Bayero University, Kano, and immediate past Secretary General, Nigerian Association of Nephrology. And many thanks for your contributions on the program. All right, we also would like to thank Dr. Kwaifa, who has joined us here in the studio.
Yeah, Dr. Ibrahim Kwaifa.
Dr. Ibrahim Kwaifa.
He's the Chief Consultant, Physician, Nephrologist, and Head of Nephrology Unit and Dialysis, Wuse District Hospital, Abuja. Thank you so much for coming on Good Morning Nigeria.
Thank you.
Do you have a
Please.
parting shot for 10 seconds? But, okay, sorry, we don't have.
Let's also thank Paul Shobande, who is a person living with kidney disease. We thank you for your contribution and hope that help will come your way. And I also hope that the association will reach out more to philanthropists going beyond government circle. And that's been Good Morning Nigeria for today. We thank you for watching. We hope you join us again tomorrow. I am Victor Azo. Thank you for your time.
And also we want to thank Dr. Ayola, or Deyemi Ayola, who joined us from Lagos. I am Ademola Adeoye. Thanks for joining us. Do have a pleasant day ahead. Bye.